You're listening to the Pharmacy Podcast Network's exclusive coverage of the Cardinal Health Retail Business Conference and Exhibition 2017 in San Antonio, Texas. RBC is more than a pharmacy business conference. This dynamic, interactive gathering of over 6,500 pharmacy professionals is a celebration of the history and value of independent community pharmacy and provides numerous opportunities for pharmacy owners to learn how to expand their business and be more profitable. And now, here are your hosts of the Pharmacy Podcast Network, Dr. Aaron Albert and Todd Eury.
This is Adam Tressler, Director of Regulatory Affairs with Cardinal Health, and you're listening to the Pharmacy Podcast.
Welcome to the Pharmacy Podcast, coverage of the RBC 2017 in San Antonio, Texas. Welcome to the Pharmacy Podcast, Adam. How are you?
Thank you. I'm doing great. Happy to be here.
Aaron, Albert, we've been doing this now for 3 days, and it feels like a week.
That long, huh?
I'm
Best
tired.
week of your lives, right?
I'm getting old. I don't know what's happening. But Adam, give us an overview. What do you do at Cardinal Health? And tell us how that's helping to impact our industry and ultimately help patients.
Of course. So my main role with Cardinal Health right now is looking at the regulations surrounding telepharmacy. So people hear telepharmacy, they think internet pharmacy, they start freaking out. The word tele kind of scares people in general, but What we're really looking at is remote pharmacy technician oversight. It's becoming one of the advanced roles for a pharmacy technician, and telepharmacy really started for rural areas that didn't have access to a pharmacist. So you think of areas, the one that comes to mind all the time being in Texas right now is Turkey, Texas. Turkey, Texas was 50 miles from the closest pharmacy. Patients had to drive 50 miles each way to get any kind of prescription help, consultations, etc. What they did is they put a telepharmacy in the town of Turkey, Texas to enable those patients not to have to leave. So it's pharmacist, every step of the process is still in place. Pharmacist checks the prescription, pharmacist checks the fill, pharmacist counsels the patient, they just do it from a remote location. And that's really where telepharmacy is helping the pharmacist access more patients. It's really increasing access is the concept behind it.
So Adam, you're clearly passionate about this topic. Can we back up a little bit? Tell us how you personally got involved in telepharmacy.
Well, we could have a really long story about how I got involved in telepharmacy. We'll back this up maybe 5-10 years. I was at the Texas Board of Pharmacy meeting, and I've always had a passion for advancing the role of the pharmacy technician. As a pharmacist, I always said, let's use our technicians as much as we possibly can so we can practice at the top of our license, counsel patients, take care of patients, etc. So I was at the Texas Board of Pharmacy, and I was talking about how I wanted to allow my technicians to do more. I had no idea how to do it. I had no idea. I was not involved politically whatsoever throughout pharmacy school, throughout my entire life. I just knew I wanted my technicians to be able to do more so I could take care of my patients better. And I was fairly passionate about it, I guess, at the meeting because I got offered a job with the Pharmacy Technician Certification Board. After that meeting, they said, we think you did such a great job. Would you be interested in interviewing? And at the time, I'll interview. I didn't think anything would come of it. But they ended up hiring me. So I was Director of Strategic Alliance for the Pharmacy Technician Certification Board, and I was going around talking about advancing the role of the pharmacy technician. Next thing you know, I'm at a board meeting in Minnesota, and I hear a company talking about telepharmacy, and they start talking about how they want to expand the scope of the pharmacy technician to allow the pharmacist to oversee more patients, reach out, take care of more people. And after that meeting, our founder, Roby Miller, doesn't remember, but I actually talked to him about it and said, this is really interesting to me, and had a big conversation with him about it. That was the end of that. A couple more states, I ended up seeing them at those states as well, and they started talking about telepharmacy. And after each meeting, I would pull them aside and just talk to them. I had tons of questions: what telepharmacy is, how is it working? You hear telepharmacy, you think your immediate reaction to my immediate reaction was pharmacist jobs are going to be gone. This is the end. This is the beginning of the end. But I started to get it explained to me that this is actually a way to create more pharmacist jobs. There's a study out of North Dakota that shows it created 80 to 100 jobs when they implemented telepharmacy. A way to reach more patients, just a way for the pharmacist to be more prevalent in healthcare. Anyways, long story short, I'm kind of rambling. He ended up offering me a job to help him. I said no. Another year passed, and he continued to offer the job, and I said, you know what, I'm going to take a risk. It was a startup at the time. Made the jump over there. I was passionate enough about the concept of telepharmacy that I wanted to do it. Spent about a year with them, and then Cardinal Health came in and said, we see what telepharmacy is doing. It's helping keeping our independent pharmacists open. This is a huge tool for our independent pharmacists to increase their reach to the patients they're already reaching, to create a health hub in these communities, another toolbox for them, and they ended up acquiring us. Once they acquired Telepharm, I went into the regulatory affairs side of their business, and here we are today.
So I'm going to draw an audio diagram, since this is a this is an audio blog podcast. You have the main pharmacy.
Mm-hmm.
You have satellite pharmacies. So I'm assuming it's a satellite pharmacy. Talk about the infrastructure in that satellite space.
Yep. So our model is a brick and mortar pharmacy. So it's a brick and mortar space, mom and pop pharmacy that everybody always thinks of. But the patient would get their prescription, they walk in, they hand it to the pharmacy technician. The whole facility is overseen by cameras. So there is a pharmacist at another site that has cameras on the whole facility. They know when people are coming in, they're just not on site. Pharmacy technician enters all the data into the system. The pharmacist at the other location looks at it for clinical accuracy, relevance, etc. If it all looks good, they give them a thumbs up, and it's not just a thumbs up, it's a digital signature. Every step of the process is recorded along the way. The technician then proceeds through filling the prescription. They take images of every step of the fill of the process. Those images, again, go back to the pharmacist. The pharmacist looks at them. If they give them the okay, it moves back to the pharmacy technician, who can then have the prescription ready to be picked up. Patient comes in to pick up the prescription. You can't sell it until the pharmacist does a consultation. So the technician might try to scan it. It'll say consultation required. Patient walks over in front of a tablet, picks up a phone, and talks to a pharmacist, has a face-to-face consultation with the patient.
So is this being integrated with the pharmacy management system? Because many of the pharmacy management systems that are actually also right here at the RBC have these workflow components where you do data entry, you do initial check, you do final check, you do printing of the label. So talk to us about that. Talk to us, where's the integration into these pharmacy management systems, and what technology are you bringing to the table?
So we try to have that same two-way integration. I believe with everybody here, we have a two-way integration with their pharmacy management system, where everything we enter in our system gets put into theirs, everything they put into theirs gets put into ours. What we're really doing is allowing that bridge, similar to the way you would have a robot speak to your pharmacy management system. The telepharmacy system we provide allows that bridge to have that telepharmacy in that remote site. So to allow the consultation to occur, to allow the imaging of the prescription fill to occur, and to allow the telepharmacy to operate.
So Adam, before we started recording, we were talking about the legislative momentum that's behind telepharmacy. Would you like to share some of that?
It's been a whirlwind. One of the reasons I was excited about this job is I thought my travel would go down because telepharmacy wasn't such a big topic. But
like a telewebinar.
Yeah, it's just been an explosion. I think people are really seeing the use case of telepharmacy, not just in urban area or not just in rural areas, but we have lots of use cases in urban areas. We were having a discussion earlier about an HIV clinic. Maybe they'll see 20 patients a day. They can't afford to have a pharmacist on site, but the patient gets their prescription. They have to go to a community pharmacy where they may not talk to a residency-trained pharmacist. There's a stigma with the disease. Why not have a telepharmacist have access into that clinic? They'll do a residency-trained consultation for the patient, give them the medication, adherence, get them out of there. Basically, overall, help healthcare, help the outcome of the patient. So I think a lot more states are kind of seeing this concept. They understand telepharmacy is here, it's real, it's happening, it's a benefit for the patients, and every state wants to start writing rules now. So it's been a huge increase. We were mentioning just yesterday, I noticed a new state that we haven't been looking at added it to their agenda, so we're going to have to be dealing with them. It's been a lot of travel, a lot of time on the road, but it's a great cause in my mind.
A two-part question. Number one, how many states are not only allowing but compensating, making inroads for compensation for telepharmacy services? And number two, when do you think it'll be nationalized from a perspective of CMS reimbursing pharmacies through Medicare, Medicaid, depending on if it's senior care or if it's community? Like, give us an overview of that as well, if you have information on that.
Yeah, that's a bit of a challenging question as well. So it depends on what you consider a pharmacist services, and that's a whole other discussion we can have. Is this a pharmacist just filling prescriptions, or are we getting reimbursed for our consultations? We just saw Michigan actually pass legislation that allows a pharmacist to get reimbursed for an MTM through telemedicine.
Excellent.
But if you're looking at states that just reimburse a pharmacist for filling a prescription, there's about 20 of them right now that allow the pharmacist to oversee a telepharmacy. They have rules that differ probably across the board. There's states like Illinois and Idaho, which are very open telepharmacy rules. There's no mileage restrictions. You can put a telepharmacy anywhere. If Walgreens will rent you space on their roof, you can put a telepharmacy there. They go all the way across the board to Tennessee, which will only allow a telepharmacy in a federally qualified health center. And that's the only use case scenario. And we could talk about previous Texas rules. I could probably talk to every state has different. Nevada has a 50-mile restriction basically one site in Nevada could have a telepharmacy. So the rules are constantly changing and adapting to make it more useful. At the rate we're going, I think every state would have some sort of telepharmacy rule in place. I don't think it would be synonymous across the board. I think we're a long way to go for that. NABP actually released a model act of telepharmacy rules this year, since they see it coming down the pipeline. Probably close to 2020, I think every state. A lot of them are sitting right now and just watching to see what happens. They want to see how this is playing out in other states. What's the next step? How can we make this successful? What rules need to be in place to make sure that this is protecting the pharmacist while providing the most patient safety possible?
So fast forward 20 years from now, Adam, and tell us what the future of pharmacy looks like from your point of view. You know, Amazon purportedly is coming into this space. I think there's a lot of change right now in pharmacy overall. So
yeah, I unfortunately have that discussion with a lot of people just about Amazon and drone delivery, and if we don't think prescriptions are going to be delivered by drone in the next 5 years, we're crazy. Pharmacists are not going to be, in my opinion, and this may get me in trouble with my bosses, but I personally don't think pharmacists' focus is going to be filling prescriptions. It's going to be on the clinical services. You look where we're shifting. The point-of-care flu testing just makes so much sense to me, and I remember talking to Alex Adams back when he was with NACDS. He's the exec of the Idaho board right now. He was with NACDS, and he was putting this together, and just the concept of you can walk into any pharmacy, you don't have to wait, you can get a flu test. The pharmacist isn't doing any diagnosis, the test is doing the diagnosis. If you're positive, you can get the Tamiflu and go home. And the access to pharmacists and how patients see their pharmacist more than any other healthcare provider, I think that's really where we're going. The more we concentrate on, I would love to get the DIR problem fixed. I just don't know if PBMs are really that flexible at this time. I think it's a huge issue that we need to resolve. But just the future of filling prescriptions is not utilizing the pharmacist. Our purpose and our value is counseling the patient, preventing errors, increasing adherence, increasing compliance, and there's so many other things we can do. I wish I had the data off the top of my head, but if you look at the number of patients who have been immunized since pharmacists can do immunizations, I know it's skyrocketed, and I wish I could remember it, but just being able to provide that coverage, once you can walk into your pharmacy and get your flu shot, people start getting flu shots much more often, and that's really where I see healthcare going.
So Aaron concentrates on a segment of the Pharmacy Podcast that's all about career development. At the beginning of the interview, you said that there might have been a fear that this will diminish the pharmacist's need. It's the exact opposite. So I could see Aaron having a whole show just developed around the telepharmacist, the future of telepharmacy, and what career opportunities there are, because it's going to increase. So there is opportunities for a pharmacist that's at a central hub of 6 micro chain stores, independent pharmacies, and they want to expand, and they put their 7th satellite office, which is telepharmacy.
Yeah, you look at every pharmacy that closes because the independent pharmacy just can't stay open. That's a loss of a job. And I think we forget about that. We don't consider that every single time an independent pharmacy closes, we lose a pharmacist job. A telepharmacy opens, it adds access to a pharmacist, it adds a pharmacist job. You look at the number of prescriptions, patient non-adherence, which is a huge problem. IMS says at least 30% of prescriptions go unfilled. If we can have access to a pharmacist, there's a study out of Kaiser that shows non-adherence drop down to 5%. So we're filling more prescriptions. Patients are actually taking their meds. There's less unnecessary prescribing of fills. It's better healthcare overall, but it's showing the pharmacist value and adding more jobs for a pharmacist. Anywhere we wanted to put a pharmacist, but you always look at it and say it just doesn't make financial sense. These patients need our access. They need the pharmacist specialty or expertise, but we just can't afford it. And that's really where telepharmacy creates jobs and adds telepharmacy.
So talk to us about the guidance that your department within the universe of Cardinal Health provides to an independent pharmacy to assess and to design and to implement a telepharmacy.
So I don't fully deal with that part of the department, but I can do it to my best of my knowledge. I'd definitely love to grab one and then to come over. But the highlights, we really like to identify areas where previous customers have had success. We look at what they've done, why they've done it, population, if there's a clinic in town, distance from another pharmacy, number of prescriptions overall, and kind of say, this looks like it could be the ideal area. But what I do know is from start to finish, we show up, we help install the software, we have a large network of telepharmacists that we can connect them with to talk about operations. We help with develop policy and procedures. We help with the regulatory effort. We basically, and we don't do it just for us. We want telepharmacy to be successful. We want to help patients, and that's really the purpose of Cardinal buying this, is to keep independents open and help as many patients as we possibly can. And this is just that tool to help that shift over there.
So Todd loves to talk about the call to action. So let's say, hypothetically, there's pharmacists listening to this podcast or pharmacy students that have a passion for telepharmacy. How can they take their game to the next level?
So this may sound a little hypocritical, because previously I said I was not involved in pharmacy school at all. I just went to school. But what I've learned the most is the power of the associations. And getting that political process started, talking to your association, saying this is something that we want to see in place. And the associations all work with legislation, get the legislators involved. Once the legislators are involved and they can say, especially the ones who are in the rural areas, and they say, wait, the towns I serve can have better access to a pharmacy, the light bulb goes off and they say, I want this. And that's what we're seeing happening in all these states. So if you're listening and you wanted to get involved, I would definitely say talk to your association, talk to your local legislators, talk to your state reps and senators, and let them know this is something that you want in your town and it would be beneficial for you to be able to provide access to patients and get them involved.
What data are you able to gather and give back to a political figure, a state representative through the State Pharmacy Association, for example, that promotes and supports the expansion of telepharmacy?
I'm trying to think of which study. I mean, I feel like we're reading studies constantly every day that just show the access to a pharmacist improves outcomes of a patient. And I think that's the biggest return on the value right there, is if you can have more access to a pharmacist, patient outcomes are better. We were talking earlier about how prescribers are looking at prescriber dispensing, not because they want to. They really don't want to. They just are getting judged on patient outcomes and judged on whether their patients take their medications. So they want their patients to get their medications. And if there's not a pharmacy in town, they can't really get that. Smaller things, it was interesting when we were opening some telepharmacies and I realized that the local grocery store is the one that's carrying the Sudafed. Not the Sudafed, but they're the one that are carrying the cough and cold medication, the aspirin, et cetera. And who does the patient talk to when they want to know if that interacts with their medication, because there's no pharmacist in town? They're not calling their local pharmacy. They're just saying, oh, I'll try this aspirin and take it home, and they're on Coumadin and nobody's there to tell them. You put it into that local pharmacy, it has that access. So there's a study out of North Dakota State University that I mentioned previously. It was kind of the landmark study of telepharmacy. And if you look at the charge of a state board of pharmacy, it's protecting the safety of the public. The study looked at 83 pharmacies between 2004 and 2008, I believe, and it really surprised me that there were 83 telepharmacies in operation in that time. But it showed that the error percentage rate in a telepharmacy was less than 1%. The national error rate in a traditional pharmacy was 1.7% at the time. So that was really the landmark study that shows telepharmacy can be performed safe. I think that's really important for a legislator to see. But it also added 8,200 jobs to the state of North Dakota, which is another, if you think of every telepharmacy that opens, again, it adds it adds a pharmacist, adds a pharmacy technician. Not only that, we have case studies, the one that comes to mind in Zearing, Iowa. There was a physician's assistant who they lost their pharmacy in their town. The pharmacy, she started losing business. We put a telepharmacy in the town. All of a sudden, she had to hire a second PA because people were leaving town to go to the doctor while they were out of town at their doctor. They were getting their prescription filled. They're doing their food shopping. It just led to a decline in the rural town, considered just the healthcare system in general. So going back to where we were going with that, it showed a creation of 8,200 jobs, and it also added $26.5 million to their local economy. Jeez. So it's great across the board. There's also statistics that we have that show each telepharmacy that opens adds $640,000 in local economic development. Payroll taxes, jobs, sales tax, et cetera. It's really a way to rebuild that local town.
So in closing, for the audience and also for our listeners, what next steps? As Aaron says, I'm a call to action guy. So what do? They reach out to you specifically, your department, give us a domain. I'll have some links in the show notes about this, but give our listeners some direction.
We have a newsletter that you can subscribe to, and that would be probably the best way to get the most information possible. If you go to telepharm.com, there's a link to our newsletter. You subscribe to that. We give you updates weekly of everything that's going on in every state. People are more than welcome to reach out to me. We're looking for champions in states who want to drive this, to show how this can be used effectively. We have a customer, and our first customer in Texas should be opening up this month. They just passed legislation, and he reached out because he understood the concept and wanted to do this for this town. He was driving 30 miles each way to deliver prescriptions. Wow. It means a lot more when a champion of the town says, I want to serve my patients and I want to do this, than when I come over from Cardinal Health and say, we want to implement this. So reach out to me, subscribe to our newsletter. I definitely recommend talking to your associations. If you know your local legislators, definitely reach out to them. They can really get this done the fastest. We're happy to help in any way we can. Whether you use our solution or not, we think telepharmacy as a whole is great for the industry.
Adam Chesler. Well, thank you very much for being on the Pharmacy Podcast.
Thank you guys for having me. I appreciate it.
Cardinal Health, helping independent pharmacies successfully grow their pharmacy businesses for over 45 years while advocating stronger relationships with patients for healthier communities throughout the country. We thank you for listening to the Pharmacy Podcast live coverage of the Cardinal Health RBC 2017. Be sure to join us next year for the RBC 2018 in downtown beautiful San Diego, California, June 27th through June 30th.